Hello and welcome to Generational Wellbeing with Dr. Lum. Thank you for joining me here today. Please like, share, and subscribe. Today I will be talking about seasonal allergies. The weather is finally changing, it's getting warmer, and kids are ready to go out. But so is the pollen. We have trees are blooming, so we have those tree pollens that are causing symptoms. I've started seeing kids with a lot of runny nose, itchy eyes, congestion, and stuff. So I'll give you a few things you can do to help reduce the severity of the symptoms during this season and help decrease the amount of complications, because yes, the seasonal allergies, but it's not only about that, because there are some kids that the allergies are causing inflammation, obstruction in their airways will interrupt sleep. So there's some kids that we're seeing behavioral changes in them because they're not sleeping well at night because of the allergy symptoms, and as a result they're irritable, acting hyperactive in school. And us as parents, we're having to go pick them up from school frequently because your kid is sick again. And other complications include recurrent ear infections. You don't want to keep giving them antibiotics and stuff for either recurrent ear infections and or sinus infections. And for some of our severe cases like asthma, our asthmatics sometimes are being triggered by allergies and stuff. So why does this really happen? When our bodies see an allergen or something that can trigger the immune system or sees it like as a foreigner, so to speak. So whether it's pollen, whether it's food, whether it's something else that would trigger the immune system to release or fight to kind of get rid of that allergen or an intruder, so to speak, sometimes the immune system overacts, right? It produces in excess, and as a result, when it releases different arms of the immune system, you have different symptoms. So for example, if you have like a histamine release, and then you have symptoms of itchy eyes, itchy nostrils, runny nose, congestion, which would lead to obstruction in some of those symptoms that I just talked about. And or if another arm of the immune system is involved, you can have increase in inflammation, constriction of airways, like with the kids like in the kids who have asthma, and that can also lead to difficulty breathing. They can move air into their lungs, and if you have a kid with asthma, you know what I'm talking about, because that can be really scary. So what are the ways you can do to prepare yourself? So if you have a kid, or if you yourself are experiencing these symptoms, what are the things you can do to help you where you're not, you're reducing the severity of the symptoms you're experiencing, or maybe even free from the symptoms? So the first thing I'll say is, since we know there are these pollens or allergens that are outside, we don't want to keep our kids inside all the time, right? So when you come back inside, the recommendation is to take your clothes off at the door, your shoes off at the door, hand washing, and also washing your face as well. Because sometimes as those pollens fall, they can fall on your eyelashes too. And we carry that stuff with us into the bedroom, and they're there and you're constant contact with it. That will produce even more symptoms. So really, hand washing, facial washing, removing all your clothes and leaving them at the door, or finding a hamper or something where you put them in there and moving in. If you're able to take a cold shower to just wash everything off at that time, absolutely something you can do as well. And second thing you can do is saline rinses, where again we're having those pollens not only in the eyes, sometimes you have it in the nostrils and stuff. You can do a saline rinse and stuff just to help kind of rinse out the pollen. Now, you know, there's so many kids that are not a fan of the saline rinse, right? But there's an option, like they have saline gels now that are tolerated better and also helps to moisturize those airways. Because one other complication that I've noticed with kids who have the recurrent allergies and recurrent infections, you know, or upper airway issues, because they're constantly rubbing, you kind of traumatize those blood vessels there. They're more prone to those bleeds and stuff. So if we can help reduce those symptoms, help keep them from really rubbing and pulling or rubbing, that can reduce not only the symptoms but also reduce the risk of them having recurrent nosebleeds. Now the third thing you can do is food. a lot of research has shown that the kids or the teenagers, one research study in particular showed that the teenagers who ate more of like the whole grain foods, plant-based foods with nuts and vegetables, they had a lower risk of having allergic or severe symptoms like wheezing, runny nose, and stuff. And another study also showed that the whole foods are actually better at reducing it than the supplements, right? Because what we want to do is we want to go out, it's easier to just take like a vitamin C pill or vitamin E pill. Oh, that's going to do it, right? No, it really doesn't. So you want to be mindful about what you're eating, like the supplements. When you compare the supplements to the whole foods, it's not equivalent. So rather than going out there and buying extra vitamin C and just popping those pills, how about we find the foods that are high in those things that we need? So replace your snacks, the highly processed snacks, you can start replacing it with nuts. Walnuts has actually been shown to be high in antioxidants and omega-3 as well. So if you want to replace those highly processed snacks with like walnuts, that's a good thing too. And then other sources of vitamin C are strawberries, kiwi, broccoli, guava. So those are all options that are great snacks. So you can replace all those processed food snacks with fruits and nuts, because you're getting the whole plant, you're getting your fiber, you're getting vitamin C and vitamin E that are helping to fight those allergens and also those recurrent infections as well. So the studies show that getting at least grade 2 or greater than 2 servings of fruit vegetables a day will make a huge difference in the outcome. Hydration is really important too. And when I say hydration, mostly water, and you can infuse the water with those fruits that I just listed earlier. Because when we say hydration, we tend to go back again to go find the juices that are high in sugars that have added vitamin C there. So we think we're getting the vitamin C from the juices, which yes, we may be getting it from them, but they're also processed, and there's also added sugars and other added stuff that may not be really helping our outcomes or helping us get the outcomes that we desire. And finally, the over-the-counter options as far as medications like antihistamines and nasal steroids are the other options you can buy from the pharmacy to help you with your symptoms. Now, speaking of those, though, the decongestants, though, are not really good for these symptoms because they'll make you feel better immediately, but then the side effect of that is it's going to come back and you're going to get more congested. So you find that you're absolutely really needing to use that so frequently. So if you find yourself doing that, you may want to stop the decongestant. You may feel bad a little bit, but overall, long term, it's going to be more beneficial for you. And for those with severe symptoms, you may want to see your doctor or your allergist specialist for those. Well, hope this was helpful to you. Please like, share, subscribe, and let me know what other topics you would like for me to talk about next time. Thank you.